Hi, I'm Dr. Shane Simpson. I'm one of the veterinarians here at Karingal Vet Hospital, and this is Ella. She's our demonstration dog for today. What we're going to be talking about is ear problems, and ear problems are something that we commonly see in dogs, particularly in the summer months with allergies. They get a lot of infections, yeast infections and bacterial infections. And so owners should check their dog's ears fairly regularly, sort of once a week's not a bad idea, just to lift the flap of the ear and have a look at the ear there, make sure that there's no discharge, that the ear flap isn't red and inflamed, and also watch the dog. If it's obviously shaking its head and scratching, then there's a problem, and then we need to see those dogs as quickly as possible. And depending on the type of infection that's in there, generally what we do is take a swab from those ears, have a look under the microscope and assess what type of infection that's in there. That could be a bacterial infection, that could be a yeast infection. Sometimes it might be ear mites, which is a common problem in puppies and kittens. And from that swab, we can determine what type of treatment we need to use. And there's a number of different types of ear drops and ear medications that we use. And we try and cater that to match the type of infection and also the temperament of the dog. So some of them are given once a week, some of them are given once a fortnight, some of them are twice a day, for example. So in Ella's case here, we're going to show just how to administer those ear drops. Most owners are a little bit cautious when it comes to placing ear drops in their dog's ears because they're worried about damaging the ear, but it's quite simple. And so what we generally use, most of the ear drops come with little squirter bottles. We try not to actually use those because it's difficult to assess how much medication you're putting into the ear. So generally what we do is use these little syringes, and we'll get the bottle and suck up the regular amount that we need. And so for example, it's 1 ml, and Ella's a really good patient. She'll just sort of stand there. It's always good to have a good patient, but generally we just flap the ear back. I use my thumb on the top of the head to hold the ear flap out of the way, and then just gently insert the needle, or the syringe, sorry, into the ear canal and just gently deposit the medication in. And then you give it that a bit of a massage. And what will happen, gravity will allow that medication to get down into the ear canal, coat the ear canal and fight off the infection. And then you just follow the rest of the prescription details as far as whether it needs to be given once a day, twice a day, etc. And then generally what we do, it's sort of either 10 to 14 days after the start of the medication, we'll get the dogs back in for a recheck, repeat the swab, make sure the infection's under control. So many breeds that we see have naturally hairy ears, particularly the poodle breeds. And it's important not to pluck that hair out because it causes inflammation, and that actually leads to infection. So if we're going to need to remove any of the hair, it's best to use a small set of clippers and just clip some of the hair away, but don't pluck it out. Good dog.